इंपॉर्टेंट जो क्वेश्चन है PYQ जो है वो साथ में करते हैं, बिना टेंशन के आगे बढ़ते हैं। चलिए तो स्टार्ट करते हैं, धीरे धीरे आप आंसर बताते जाइए अगर आपको पता हो तो। एक एक करके आराम से करेंगे, 50 क्वेश्चन करेंगे, थोड़ा ऊपर नीचे हो सकते हैं, एक दो ज़्यादा कम। तो चलिए 1 घंटे का सेशन है, स्टार्ट करते हैं। फर्स्ट क्वेश्चन, विच ऑफ द फॉलोइंग DMARDs use requires regular monitoring of visual acuity and fundus examination? Option A, methoxyrate. Option B, hydroxychloroquine. Option C, sulfasalazine. Option D, leflunomide. क्या लगता है आपको? एक बार वॉइस चेक कर लेते हैं। फटाफट आंसर बताइए, क्या लगता है आपको? So the right answer is option B, hydroxychloroquine. चलिए थोड़ा इसका एक्सप्लेनेशन देखते हैं। हाइड्रोक्सीक्लोरोक्वीन टॉक्सिसिटी कॉजेज बुल्स आइज मैकुलोपैथी, hence ophthalmic monitoring every 12 months is necessary. चलिए नेक्स्ट क्वेश्चन पर आगे बढ़ते हैं। और नीट पीजी एफएमजी तो सब चीज चल बढ़िया रहा होगा आपका। नीट पीजी के थोड़े कम दिन हैं, 10-15 दिन एक्स्ट्रा हैं अपने एफएमजी के। कोई नहीं, लगे रहिए, हो जाएगा सबका क्लियर। बस यहाँ पर हमें अपनी हिम्मत नहीं हारनी है, लास्ट तक लगे रहना है और एमसीक्यू सॉल्व करते रहना है। प्रीवियस ईयर क्वेश्चन हो या न्यू क्वेश्चन हो, वो सॉल्व करते रहना है, क्योंकि हमें तभी पता चल पाता है कि हमें कितना रिटेन कर पा रहे हैं हम याद करा हुआ, कितना नहीं। चलिए नेक्स्ट क्वेश्चन, अ फीमेल प्रेजेंटेड विद बर्निंग मिक्सचुरेशन एंड सिम्टम्स ऑफ यूरिनरी ट्रैक्ट इन्फेक्शन, which of the following fluoroquinones is least likely to be effective? Option A, ofloxacin. Option B, ciprofloxacin. Option C, moxifloxacin. Option D, levofloxacin. क्वेश्चन दोबारा सुनिए। A female presented with burning micturition and symptoms of urinary tract infection. Which of the following fluoroquinones is least likely to be effective? Option A, ofloxacin. Option B, ciprofloxacin. Option C, moxifloxacin. Option D, levofloxacin. So the right answer is option C, moxifloxacin. थोड़ा इसका हम एक्सप्लेनेशन देखते हैं। Moxifloxacin does not accumulate significantly in urine and is not approved for the treatment of urinary tract infection. Or ciprofloxacin and ofloxacin and levofloxacin can be used in UTIs. चलिए नेक्स्ट क्वेश्चन पर आगे बढ़ते हैं। A patient on anti-cancer therapy. A patient on anti-cancer therapy developed infection. Blood analysis revealed a total leukocyte count of 2000 mm³. Which of the following drug is likely to be effective in this patient? Option A, romiflozin. Option B, oprelvecin. Option C, filgrastim. Option D, erythropoietin. ऑप्शन दोबारा सुनिए। ऑप्शन ए, रोमिफ्लोस्टिल। ऑप्शन बी, ओप्रेलवेकिन। ऑप्शन सी, फिलग्रेस्टिन। ऑप्शन डी, एरिथ्रोपोइटिन। So the right answer is option C, filgrastim is the right answer. चलिए नेक्स्ट क्वेश्चन पर आंसर फटाफट बताते जाइए। A person presents with acute chest pain. Nitroglycerin was given sublingually and pain relieved within 5 minutes. What is the likely mechanism of this drug? Option A, release of endothelin. Option B, release of nitric oxide. Option C, calcium channel blockade. Option D, beta blockade. क्या लगता है आंसर? So the right answer is option B, release of nitric oxide. थोड़ा explanation देखते हैं. Basically, the mechanism of action of nitroglycerin is the release of nitric oxide. Nitrates causes a favorable redistribution of coronary blood flow to ischemia areas without an increase in total coronary flow. चलिए नेक्स्ट क्वेश्चन पर आगे बढ़ते हैं. Patient has pain in the facial nerve distribution while chewing and speaking. Which of the following drugs should be given for the treatment? Option A, lamotrigine. Option B, carbamazepine. Option C, phenobarbital. Option D, haloperidol. क्या लगता है आंसर? So the right answer is option B, carbamazepine. Carbamazepine. थोड़ा सा explanation देखते हैं. Carbamazepine, a sodium channel blocker, is the primary agent for the treatment of trigeminal neuralgia. चलिए नेक्स्ट क्वेश्चन पर आगे बढ़ते हैं. Which of the following is a true statement regarding Alice Kiran? Alice Kiran. Option A, it is indicated in diabetes mellitus. Option B, it can be given in pregnancy. Option C, it increases renin levels. Option D, it increases aldosterone level. So the right answer is option C, it increases renin levels. Aliskirin, थोड़ा explanation देखते हैं. Aliskirin is the direct renin inhibitor used in the treatment of hypertension. It is a competitive inhibitor of the active site of renin and the block conversion of angiotensinogen to angiotensin 1. Aliskirin also decrease aldosterone levels and enhance natriuresis. चलिए नेक्स्ट क्वेश्चन पर आगे बढ़ते हैं. A 40-year-old man was treated for a high-grade soft tissue sarcoma with radiotherapy. Since he was not responding, he was shifted to chemotherapy. After initiating chemotherapy, he developed erythematous rashes over the areas where radiotherapy was administered earlier. Which of the following drugs causes this condition? Option A, vincristine. Option B, doxorubicin. Option C, cyclophosphamide. Option D, 6-mercaptopurine. क्या लगता है आंसर? So the right answer is option B, doxorubicin. चलिए नेक्स्ट क्वेश्चन पर आगे बढ़ते हैं. A child accidentally took a bottle full of iron tablets. Which drug is used as antidote for poisoning? Option A, luspatercept. Option B, deferoxamine. Option C, deferriperone. Option D, DMSA. क्या एंटीडोट है आपका आयरन चिलेट आयरन का? सो द राइट आंसर इज ऑप्शन बी, डिफेरोक्सेलमीन. Diferoxamine, a potent iron chelating compound, can be given intravenously to bind iron that has already been absorbed and to promote its excretion in urine and feces. चलिए नेक्स्ट क्वेश्चन पर आगे बढ़ते हैं. Adrenaline acting through beta-2 receptors cause bronchodilation, whereas histamine acts through H1 receptors to cause bronchoconstriction. Which type of antagonism it is? Option A, physiological antagonism. Option B, chemical antagonism. Option C, reversible antagonism. Option D, competitive antagonism. क्या लगता है? So the right answer is option A, physiological antagonism. चलिए नेक्स्ट क्वेश्चन पर आगे बढ़ते हैं. A 4-year-old boy presents with a history of facial edema that has now progressed to total body swelling involving the face, abdomen, scrotum, and field. Urinalysis revealed protein 4 plus and a urine protein creatine ratio of 3. What is the initial treatment of choice for this child? Option A, prednisolone. Option B, cyclophosphamide. Option C, levamisole. Option D, cyclosporin. क्या लगता है आंसर? So the right answer is option A, prednisolone. थोड़ा एक्सप्लेनेशन देखते हैं. Minimal change, nephrotic syndrome, and the initial treatment of choice is corticosteroid such as prednisolone. चलिए नेक्स्ट क्वेश्चन इंपॉर्टेंट. A 72-year-old male presents with complaints of a weak urinary stream and frequent urination in small amounts and is on prazosin. He also mentions that he frequently feels lighted and and has low blood pressure. Which of the following alpha blockers will you prefer to give him? Option A, alfuzosin. Option B, terazosin. Option C, tamsulosin. Option D, doxazosin. So the right answer is option C, tamsulosin. Basically, the scenario is a benign prostate hyperplasia, and term solutions should be given as it has the least effect on blood pressure. Which monoclonal antibody is used in cancer treatment? Which monoclonal antibody is used in cancer treatment? Option A, omalizumab. Option B, denosumab. Option C, rituximab. Option D, methoxyrate. क्या लगता है आंसर? So the right answer is option C, rituximab. Rituximab is an anti-CD20 monoclonal antibody and is used in the treatment of lymphomas. चलिए नेक्स्ट क्वेश्चन पर आगे बढ़ते हैं. A 26-year-old woman presents with a unilateral throbbing headache associated with nausea and vomiting. She has had similar episodes in the past where the headache usually lasts for 1 to 2 days. Bright light increases her discomfort and she prefers sitting in a dark room. Which of the following drugs can be used to decrease his headache episode in the future? Option A, propranolol. Option B, alprazolam. Option C, diazepam. Option D, fluoxetine. So the right answer is option A, propranolol. थोड़ा explanation देखते हैं. Multiple unilateral throbbing headache associated with nausea, vomiting, and photophobia suggest a diagnosis of migraine headaches, and the drug used in the prophylaxis is propranolol. Next question. Which of the following is a selective estrogen receptor modulator? Option A, estrogen. Option B, metformin. Option C, tamoxifen. Option D, adriamycin. Adriamycin. So what is the answer? Comment. So the right answer is option C, tamoxifen. Tamoxifen is the selective estrogen receptor modulator that is used for hormone receptor positive breast cancer. चलिए नेक्स्ट क्वेश्चन पर आगे बढ़ते हैं. A new drug is introduced into the market after which phase of the clinical trials? Option A phase 1, option B phase 2, option C phase 3, option D phase 4. क्या आंसर लगता है आपको? So the right answer is option C phase 3. Next question. Beta blockers should be avoided in all except A. Asthma, B. Glaucoma, C. Bradycardia, D. Hypothyroidism. Answer. So the right answer is option B. Glaucoma. Next question. A patient presents with swelling in MCP joints and his serum uric acid levels were increased. The doctor prescribed a medicine which is considered as the first line agent in the management of this condition. What is the mechanism of this drug? Option A, pyrimidine antimetabolite. Option B, inhibitor of neutrophil recruitment. Option C, uricosuric drug. Option D, xanthine oxidase inhibitor. क्या लगता है? So the right answer is option D, xanthine oxidase inhibitor. Explanation पे allopurinol is recommended as the first line urate lowering agent in all patients with gout. It is a purine antimetabolite and an inhibitor of xanthine oxidase enzyme. चलिए नेक्स्ट क्वेश्चन पर आगे बढ़ते हैं. A farmer was brought to the emergency department with diarrhea, sweating, excessive lacrimation, salivation, and garlicky odor. His pulse rate is 55 per minute and his plasma cholinesterase level was 50. Which of the following can be used to treat this patient? Option A, neostigmine. Option B, atropine. Option C, epinephrine. Option D, benztropine. क्या लगता है आंसर? So the right answer is option B, atropine. Next question. Which among the following drugs does not require any renal dose modification in those with chronic kidney disease? Option A, saxagliptin. Option B, ripaglinide. Option C, linagliptin. Option D, glyburide. क्या लगता है आंसर? So the right answer is option C, linagliptin. Explanation देखते हैं. Linagliptin is a competitive dipeptidyl peptidase 4 inhibitor, does not require any renal dose modification. Linagliptin binds extensively to plasma proteins and is cleared primarily by the hepatobiliary system with very little renal clearance. चलिए नेक्स्ट क्वेश्चन पर आगे बढ़ते हैं. Which of the following drugs used in the emergency management of asthma does not act by bronchodilation? Option A, salbutamol. Option B, ipratropium. Option C, darifilin. Option D, hydrocortisone. क्या लगता है आंसर? So the right answer is option D, hydrocortisone. Explanation देखते हैं. Hydrocortisone does not act by bronchodilation, while all other drugs mentioned act by bronchodilation. चलिए नेक्स्ट क्वेश्चन पर आगे बढ़ते हैं. Dopamine at low doses. लो डोज पे क्या करती है डोपामिन? ऑप्शन ए, इंक्रीजेस कार्डियक कॉन्ट्रैक्टिलिटी. ऑप्शन बी, causes vasoconstriction. Option C, increase blood pressure. Option D, increase renal blood flow. So the right answer is option D, increases renal blood flow. Explanation देखते हैं. At low doses, dopamine will act on the D1 dopamine receptor present in renal and mesenteric blood vessels to dilate the vessels and thereby increasing blood flow. चलिए नेक्स्ट क्वेश्चन पर आगे बढ़ते हैं. Which of the following PDE5 inhibitor is the longest acting? Option A, sildenafil. Option B, tadalafil. Option C, vardenafil. Option D, evenafil. क्या लगता है आंसर? So the right answer is option B, tadalafil. Tadalafil is the longest acting PDE5 inhibitor with duration of long action is 24 to 36 hours. Sildenafil is 10 to 12 hours, vardenafil 8 to 10 hours, avanafil is 4 to 6 hours. Next question. Patients receiving which of the following antimicrobial drugs are least likely to develop seizures? Option A, beta-lactam compounds. Option B, quinolones. Option C, macrolides. Option D, isoniazide. क्या लगता है आंसर? So the right answer is option C, macrolides. चलिए explanation देखते हैं. Macrolides are the least likely antimicrobial out of the given option to cause seizures. Antimicrobial associated with causing seizures is beta-lactam and related compound, quinolones, acyclovir, isoniazid, ganciclovir. चलिए नेक्स्ट क्वेश्चन पर आगे बढ़ते हैं. Which of the following antidepressant drugs act by inhibiting the reuptake of both serotonin and non-adrenaline? Option A, fluoxetine. Option B, venlafaxine. Option C, paroxetine. Option D, depoxetine. So the right answer is option B, venlafaxine is the right answer. Venlafaxine is a serotonin and noradrenaline reuptake inhibitor. चलिए नेक्स्ट क्वेश्चन पर आगे बढ़ते हैं. Which of the following drugs are used in the closure of patent ductus arteriosus? Option A, magnesium sulfate. Option B, L-prostadil. Option C, indomethacin. Option D, aspirin. क्या लगता है आंसर? So the right answer is option C, indomethacin. चलिए explanation देखते हैं. NSAIDs like ibuprofen and indomethacin are used in the medical management to induce closure of a patent ductus arteriosus. नेक्स्ट क्वेश्चन देखते हैं. Drug of choice for the treatment of digoxin-induced ventricular arrhythmia is option A, procainamide. Option B, lignocaine. Option C, atropine. Option D, propranolol. क्या लगता है? Drug of choice for the treatment of digoxin-induced ventricular arrhythmia is option A, procainamide. Option B, lignocaine. Option C, atropine. Option D, propranolol. क्या लगता है आंसर? So the right answer is option B, lignocaine. चलिए explanation देखते हैं. Lignocaine has the least effect on AV nodal conduction and is the most appropriate drug for the treatment of digoxin-induced arrhythmia. Digoxin is a cardiac glycoside with a narrow therapeutic index and is used in the management of heart failure. चलिए नेक्स्ट क्वेश्चन पर आगे बढ़ते हैं. Which of the following radioactive isotopes of iodine is used for treatment of thyroid cancer? दोबारा क्वेश्चन सुनिए. Which of the following radioactive isotopes of iodine is used for treatment of thyroid cancer? Option A, iodine 125. Option B, iodine 131. Option C, iodine 127. Option D, iodine 123. क्या लगता है आंसर? थायराइड कैंसर में क्या यूज होता है, आइसोटोप कौन सा यूज होता है? सो द राइट आंसर इज ऑप्शन बी, आयोडीन 131. नेक्स्ट क्वेश्चन पे चलते हैं. A child upon disturbing a beehive had several stings. After a few minutes, the child developed breathing difficulty and hypotension. What is the drug of choice for managing this child? Option A, Dopamine. Option B, adrenaline. Option C, noradrenaline. Option D, dopamine. क्या लगता है आंसर? तो द राइट आंसर इज ऑप्शन बी, एड्रीनालिन. चलिए थोड़ा एक्सप्लेनेशन देखते हैं. द चाइल्ड हैज रेस्पिरेटरी डिफिकल्टी एंड साइंस ऑफ vascular collapse, which is suggestive of anaphylactic shock, and the drug of choice is adrenaline. चलिए नेक्स्ट क्वेश्चन इंपॉर्टेंट. A 45-year-old woman presented to the medicine (OPD) with complaints of muscle weakness and blurring of vision following exertion more towards the evening. On examination, the patient had ptosis. The symptoms improved after adrophonium test. The person is likely suffering from option A, Lamberton Lambert-Eaton syndrome, option B, myasthenia gravis, option C, Guillain-Barré syndrome, option D, bronchial asthma. So the right answer is option B, myasthenia gravis. चलिए नेक्स्ट क्वेश्चन पे आगे बढ़ते हैं. A 32-year-old man who had traveled to Assam recently presents with fever, chills, seizures, and altered sensorium. On examination, his blood pressure was 70 by 50 mmF Hg and labored breathing was present. A blood smear was sent which revealed Plasmodium falciparum. Which of the following is the drug of choice in this condition? Option A, chloroquine. Option B, quinine. Option C, intravenous artesunate. Option D, lumefantrine. क्या लगता है आंसर? So the right answer is option C, intravenous artesunate. Basically, this scenario is a severe complicated falciparum malaria, and the drug of choice in this condition is intravenous artesunate. चलिए next question. A 55-year-old male presented with rigidity, frequent falls, slowness in his movements, tremors, and had short stepping gait. When he entered the doctor's room, which of the following neurotransmitter is responsible for this condition? Option A, GABA. Option B, acetylcholine. Option C, dopamine. Option D, serotonin. क्या लगता है आंसर? So the right answer is option C, dopamine. एक्सप्लेनेशन देखते हैं. बेसिकली ये सिनेरियो क्या कहता है? हमें लगता है पार्किंसन डिजीज है, which is associated with the degeneration of substantia nigra, which lead to decreased dopamine level in the brain. That's why the answer is the dopamine. चलिए नेक्स्ट क्वेश्चन पर आगे बढ़ते हैं. A student presents with urticaria after she ate some seafood. She wants a non-sedating drug as she has an exam to study for. Which of the following drugs would you prefer to prescribe to her? Option A, phenyramine. Option A, phenyramine. Option B, promethazine. Option C, hydroxyzine. Option D, fexofenadine. क्या लगता है आंसर? So the right answer is option D, fexofenadine. चलिए एक्सप्लेनेशन देखते हैं. Basically, the student suffering from urticaria and urticaria and the fexofenadine can be prescribed to her. This is a preferred as it is a second generation antihistamine having minimal no sedative effect as it cannot cross the blood-brain barrier easily. Okay, next question. A 45-year-old obese lady with diabetes was managed with oral hypoglycemic agents. She now presents to the casualty with a hypoglycemic episode. Which of the following drugs is most likely responsible for her hypoglycemic episode? Option A, metformin. Option B, pioglitazone. Option C, sitagliptin. Option D, glimepiride. क्या लगता है आंसर? So the right answer is option D, glimepiride is the right answer. Next question. A 66-year-old man presented with difficulty in urination, back pain, and an elevated PSA blood test. An X-ray revealed two radiolucent lesions in the bony pelvis, and MRI revealed several enlarged lymph nodes in the lower abdomen. Which of the following drugs can most likely be used to treat the given condition? Option A, anastrozole. Option B, desogestrel. Option C, goserelin. Option D, oxandrolone. So the right answer is option C, goserelin. Next question. Which of the following medication is safe for pregnancy-induced hypertension? Option A, lisinopril. Option B, propranolol. Option C, alpha-methyl-dopa. Option D, losartan. क्या लगता है आंसर? So the right answer is option C, alpha-methyl-dopa. Explanation देखते हैं. Alpha-methyl-dopa is a selective alpha-2 receptor agonist and is safe for use during pregnancy as an antihypertensive. Antihypertensive to be avoided in pregnancy: ACE inhibitor, ARBs, diuretics, non-selective beta blockers, or nitroglycerin. चलिए नेक्स्ट क्वेश्चन पे आगे बढ़ते हैं. A 45-year-old woman with lung adenocarcinoma comes for her chemotherapy treatment. She has had multiple complaints of nausea and vomiting during her previous treatment visits. Which of the following is used to prevent chemotherapy-induced emesis and vomiting? Option A, metoclopramide. Option B, ropinirole. Option C, domperidone. Option D, palinocetrone. Palinocetrone. So the right answer is option D. Palinocetrone is the right answer. Palinocetrone is used in chemotherapy-induced nausea and vomiting. Basically, the palinocetrone is a 5-HT3 receptor antagonist that blocks serotonin in vagal terminals and centrally in the chemoreceptor trigger zone. It has a higher receptor affinity as compared to the first generation 5-HT3. चलिए नेक्स्ट क्वेश्चन. What is the mechanism of action of doxycycline? Option A, cell wall synthesis inhibitor. Option B, protein synthesis inhibitor. Option C, DNA gyrase inhibitor. Option D, leucyl tRNA synthetase inhibitor. So the right answer is option B, protein synthesis inhibitor. चलिए नेक्स्ट क्वेश्चन पर आगे बढ़ते हैं. A patient presents to the casualty with a chronic dry cough with no fever or other associated symptoms. He had recently been started on an antihypertensive for hypertension. Which among the following is most likely responsible to cause these symptoms? Option A, bradykinin and renin. Option B, angiotensin 2 and bradykinin. Option C, only bradykinin. Option D, histamine. So the right answer is option C, only bradykinin. Explanation देखते हैं. Chronic dry cough is a common adverse effect of ACE inhibitors that occurs due to the accumulation of bradykinin, substance P, or prostaglandins in the lungs. चलिए नेक्स्ट क्वेश्चन पर आगे बढ़ते हैं. A patient who is a known case of chronic obstructive pulmonary disease who is on inhaled salmeterol therapy presents to the outpatient department with complaint that there is no improvement. Which of the following drug can be added to his regime? Option A, theophylline. Option B, azithromycin. Option C, oral glucocorticoids. Option D, ipratropium. क्या लगता है आंसर? So the right answer is option D, Apratropium. Basically, the patient already takes bronchodilator with inhaled salmeterol. The next step in the management of this patient is to add another bronchodilator like a muscarinic antagonist, that is ipratropium. चलिए नेक्स्ट क्वेश्चन बाय बढ़ते हैं. इंपॉर्टेंट क्वेश्चन है, ये बहुत आते हैं क्वेश्चन. सर्जरी फार्मा रिलेटेड क्वेश्चन. A patient was brought to the hospital following a road traffic accident. The patient was disoriented. CT had showed no evidence of hemorrhage, but features of cerebral edema and raised intracranial pressure was seen. Which of the following drugs can be used for the initial management of raised intracranial pressure? Option A, furosemide. Option B, mannitol. Option C, acetazolamide. Option D, glycerol. So the right answer is option B, mannitol. Basically, the mannitol can be given as first-line management to decrease the edema associated with the injury. चलिए नेक्स्ट क्वेश्चन पर आगे बढ़ते हैं. A 30-year-old man joins a pilgrimage to a shrine at a mountain peak. At the summit, he develops tightness in the chest associated with breathlessness and altered sensorium. Which of the following can be given for symptomatic relief? Option A, mannitol. Option B, digoxin. Option C, diltiazem. Option D, acetazolamide. क्या लगता है आंसर? So the right answer is option D, acetazolamide. चलिए नेक्स्ट क्वेश्चन पर. Easy question, repeated and repeated question. Which of the following drugs can cause gynecomastia? Option A, tamoxifen. Option B, oxytocin. Option C, spironolactone. Option D, clomiphene citrate. So the right answer is option C, spironolactone. Next question. What is the mechanism of action of altiplase, a tissue plasminogen activator? Option A, inhibits vitamin K dependent factors. Option B, inhibits factor 10. Option C, promotes fibrinolysis. Option D, activation of thrombin. So the right answer is option C, promotes fibrinolysin. Next question. A pregnant lady was diagnosed with extensively drug-resistant TB. Which of the following drugs is unsafe in this lady? Option A, amoxicillin. Option B, clofazimine. Option C, kanamycin. Option D, linezolid. क्या लगता है आंसर? So the right answer is option C, kanamycin. Basically, the aminoglycosides are unsafe in pregnancy, and from the option kanamycin as aminoglycosides is not used. Antibiotics safe in pregnancy include penicillin group, cephalosporin, erythromycin, and metronidazole, except in the first trimester. Metronidazole. चलिए नेक्स्ट क्वेश्चन पर आगे बढ़ते हैं. A 53-year-old female was diagnosed with breast cancer. She was managed appropriately and was advised to start chemotherapy. Further investigations were done that revealed she had heart failure as well. Which of the following drugs would you avoid in this patient? Option A, methoxyrate. Option B, epirubicin. Option C, cyclophosphamide. ऑप्शन डी सिस्प्लेटिन. क्या लगता है? So the right answer is option B, epirubicin. Next question. Which of the following is the most common side effect of orlistat? Which of the following is the most common side effect of orlistat? Option A, acute kidney injury. Option B, osteoporosis. Option C, steatorrhea. Option D, colorectal cancer. So the right answer is option C, steatorrhea. The most common side effect of orlistat is steatorrhea. Basically, the orlistat is an anti-obesity drug that acts by forming a covalent bond with the lipase in the gastrointestinal tract and thus decreasing fat absorption. चलिए next question. Which among the following is not preferred as an analgesic in rheumatoid arthritis? Option A, tramadol. Option B, ketorolac. Option C, naproxen. Option D, oxycodone. क्या लगता है? So the right answer is option B, ketorolac. चलिए explanation देखते हैं. Ketorolac is not preferred in rheumatoid arthritis. It is a potent analgesic but a moderately effective anti-inflammatory drug. Ketorolac is not administered in chronic painful conditions such as rheumatoid arthritis, and its use is limited to 5 days or less for acute conditions. Okay, no problem. Next question. A tourist with a travel history of India presents with complaints of abdominal pain and multiple episodes of watery diarrhea. He reports having food at a local restaurant the previous night. Which of the following antidiarrheal agents is used in this condition? Option A, octreotide. Option B, loperamide. Option C, option C, rifaximin. Option D, bismuth subsalicylate. So the right answer is option B, loperamide. Basically, the loperamide is an anti-diarrheal agent. Next question. High ceiling diuretics are used in the treatment of all of the following conditions except option A, generalized edema, option B, cerebral edema, option C, acute pulmonary edema, option D, pulmonary hypertension. So the right answer is option D, pulmonary hypertension. High ceiling diuretics or loop diuretics are used to treat pulmonary edema and are not used in pulmonary hypertension. They act by inhibiting the sodium potassium 2 chloride symporter in the thick ascending limb of the loop of Henle, resulting in increased secretion of sodium, potassium, and chloride. Next question. What is the most common side effect of lamotrigine? What is the most common side effect of lamotrigine? Option A, diplopia. Option B, tremors. Option C, neutropenia. Option D, weight gain. So the right answer is option D, weight gain. चलिए नेक्स्ट क्वेश्चन बाय बढ़ते हैं. Next question. Which of the following drugs is associated with untoward side effect of renal tubular damage? Option A, cisplatin. Option B, streptozotocin. Option C, methotrexate. Option D, cyclophosphamide. So the right answer is option A, cisplatin. Explanation देखते हैं. Nephrotoxicity is one of the dose-limiting toxicity of cisplatin therapy. Cisplatin achieves a high concentration in nephrons. Both direct toxicity and inflammation are responsible for nephrotoxicity. A high concentration of chloride stabilizes cisplatin and reduces nephrotoxicity. Therefore, chloride diuresis is used to reduce nephrotoxicity. चलिए तो आज का लास्ट क्वेश्चन, फिर एंड करेंगे हम अपनी लाइफ को. Which of the following statement is correct regarding the mechanism of action of labetalol? Option A, directly acts as arterial vasodilator, resulting in indirect effect tachycardia. Option B, blocks both alpha 1 and beta adrenergic receptor. Option C, primarily acts as vasodilator with little effect on arterioles. Option D, decreases peripheral vascular resistance by directly acting as relaxant vascular smooth muscles. So the right answer is ऑप्शन बी blocks both alpha 1 and beta adrenergic receptors. चलिए इसी के साथ हम अपनी लाइव को खत्म करते हैं। अगर आपको वीडियो पसंद आए तो प्लीज लाइक करें, शेयर करें ज़्यादा से ज़्यादा। थैंक यू फॉर वॉचिंग दिस वीडियो। और PYQ सॉल्व करते रहें, चाहे नए हों चाहे पुराने, प्रीवियस ईयर क्वेश्चन या PYT प्रीवियस ईयर टॉपिक बहुत इंपॉर्टेंट है। हम सब साथ में पास होंगे, टेंशन नहीं लेने का, आगे बढ़ते जाने का। थैंक यू।